Guys, what are the criteria for selecting a disease for screening? Now you want to screen people for diabetes. Okay, so what will you do? You will check their random blood sugar, right? So this is what a screening test. Now why will you choose diabetes, or why will you choose HIV? So that you can detect the disease early, right? So that you can get some lead time. Look at this, lead time. So you can start screening here, and you can, in all this time, screening time, whenever you detect, right, this is the usual time of diagnosis. So you're getting this lead time to treat, right? So the prognosis of the disease may be better. So what are the criteria for choosing a disease? Would you want to go and check one area for malaria? Do you want to screen people living in an area for malaria? Do you want to check people for breast carcinoma? Right? And who are these kind of population? What is the high risk population that you want to target and catch the breast cancer early so that you can treat it early and the prognosis can be better? So a lot of things are there like that, right? So basically, what is the criteria for selection of the disease? So you should tell the condition that should be there should be a health problem, okay? It should be a health problem. The prevalence should be high, like breast carcinoma, let us say. It is a health problem. And you should be having a recognizable latent or early asymptomatic stage. So many of these people will have an early asymptomatic stage, right? So they don't have any symptoms. They're living a perfectly fine life, but they could be having a breast carcinoma, right? Are you getting it, guys? What are we looking at in this video? Criteria for selecting a disease for screening, okay? So then what else? The natural history of the disease, including development, right, you should have understood the disease. So you should have understood the natural history of the disease. What will happen if you do not catch it early, do not treat it early, if you let it without treatment? This and all you should know. You should know the natural history of the disease. It should be understood. You should have understood the natural history of the disease. Then, you should be able to, you should have a test. First of all, you should have a test, like a screening test, which can detect the disease prior to the onset of signs and symptoms. So you should have a test. First of all, you should have a test. That is a screening test. So what is the screening test for? Breast carcinoma, mammography, MRI, ultrasound, breast self-examination, palpation by a physician. All these are screening tests for breast carcinoma. So this test should be available, first of all, right? Then only you will go and check in the population for this. So you should have the test. Then only you will go to the people, right? Yes. Then facilities should be available for confirmation. So now that you have a test for screening, do you have a test for confirmation? You should have a test for confirmation also. What is the test for confirmation? FNAC, fine needle aspiration cytology, biopsy, right? Then only you will be able to confirm that yes, this person has breast carcinoma or not. Right? So these are some of the criteria, but these are not the end of it. We still have some more criteria. So there should be a treatment. Now what is it? You got the person, you found out the person has breast carcinoma, but do you have a treatment? What is the use of finding out whether the person has carcinoma if you don't have the treatment? So you should have a treatment. Then you should have a policy to treat as patients. So policy concerning whom to treat as patients. Okay, borderline diabetes. Whom do you want to treat? Blood pressure, this is, I think. So whom to treat? You should know the policy. How to treat, whom to treat, right? There should be good evidence that early detection and treatment reduces morbidity and mortality. So there should be evidence that going and doing the screening and getting the lead time will definitely help the person, right? Then the expected benefits of early detection should exceed the risk or cost. See, mammography itself may have its own risk, right? MRI might have its own risk. Right? But the benefits should exceed the risk. Benefits should exceed the risk and also the cost. So the benefits should be more. Benefits should be more than the risks and the cost. When the above criteria are satisfied, only then it would be appropriate to consider a suitable screening test. So these are the criteria for selecting a disease for screening. So let's just take a recap. What are the criteria for selecting a disease for screening? Basically, the disease should be a health problem. You should be able to recognize a latent or an early asymptomatic stage. You should know the natural history of the disease. You should have a test that can detect, and this test should the benefits of this test should be more than its risks or costs, right? And facilities available for the diagnosis. So you should have a diagnostic test also. And then there should be treatment, otherwise what is the point? Then you should have a policy as to whom to treat as patients. There should be good evidence that early detection and treatment will reduce the mortality and morbidity. Then what else? Yes, that's it. So these are the criteria for selecting a disease for screening. Okay, and what are the examples? You can say like breast carcinoma, right? You can do mammography, MRI, ultrasound examination, breast self-examination, palpation by a physician. And then if the person is screened and it's positive, then you can go for diagnostic tests like fine needle aspiration, cytology, biopsy, etc. for breast carcinoma. Similarly, you can do for HIV, you can do ELISA, then you can do Western blot assay as diagnostic, right? For lung cancer, you can check chest X-ray, and then you can again do biopsy, CT scan. For most of the carcinomas, you can see everything says biopsy, 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 biopsy for diagnosis, right? For diabetes, you remember you will do random blood sugar on people, and then if it is high, then you will check them for fasting blood sugar greater than 126 mg per deciliter. Then it will be called as diabetes. Oral glucose tolerance test greater than 200, and HbA1c, that is glycosylated hemoglobin, greater than 6.5 will indicate diabetes. Like this, so many tests. Okay. So did you understand what the criteria are to select a disease for screening? Okay. That's all for now, guys. We'll meet you in the next video. Bye bye.